Hello, my name is Taya McClure. I'm going to be giving my sterile wound dressing change competency. And the first thing that I would get started with is just that we have to have a doctor's order in order to do a sterile dressing. And then I would go, after I get the doctor's order, I would go into the patient's room. I would address the patient. I would then ask the patient to identify themselves by asking their date of birth and their date of birth and their state their name, and then I would ask them to then I would look at their identification bracelet and make sure that what they said matches that. I would also then ask the patient if they are in any pain, because during the sterile dressing there will be a lot of touching, there will be a lot of taking things off and out of the wound and putting things back in, so it could cause pain. So I would want to make sure that the patient is okay with pain or are pre-medicated before I complete my sterile wound dressing change. I would want to educate my patient and let them know that the sterile wound dressing change is just to prevent infection and things like that. Right, and I believe that is everything. So to begin my wound dressing, the first thing that I would do is to wash my hands, and then I would put on clean gloves. Okay, when I put on the clean gloves, what I would do is there would be a previous dressing on here, and what I would do is I would take that one off. So you take the old one off with clean gloves, just because it's already a pretty much contaminated area. Don't really need sterile gloves yet. And while I'm taking the dressing off, I would want to make sure, just check over what the previous nurse did. So just making sure that the layers are correct. So making sure that the ABD pad is on top, the 4x4 gauzes are underneath, and the wet gauze is packed into the wound. All right, so after I do that, I would want to take off the clean gloves like so. All right, and I would dispose of those. And then I would make sure, well, before I even started to remove the previous dressing, I want to already have my materials, because just to make sure that the wound is not open for too long, to prevent pathogens, bacteria from getting into the wound. All right, so my materials are the 4x4 gauzes, the ABD pad, the gauze boat, sterile Q-tips, even though they're not in the packaging, just improvising they would be sterile inside of a pack. Alrighty, sterile gloves, as well as a polyline towel. So the very first thing that I would do is open my, is wash my hands, make sure I've washed my hands, and I would I will open the polyline towel. Alright, so I will open it away from me, like so. Okay. I would pick it up with my fingertips, just because it's already sterile, and I would open it up. Okay. And I will place it on to the table. Alright, so now what this does is it provides me a sterile area for my sterile materials. So what I would do, just to make sure to keep it the area sterile, I would make sure that I don't turn away from the sterile area. I would make sure that I'm keeping my hands above the table and things of that matter. I also have my normal saline as well as tape. Alrighty, next thing I would do is open my sterile package for Q-tips. I would open my boat gauze away from me, place it onto sterile area. Alrighty. I will open the 4x4 sponges as so away from me again and place it onto my sterile area. So okay. I will want to open my ABD pad away from me. Place it onto here. Alrighty. And then before I start to do my sterile dressing change, I will want to go ahead and place the tape on the, I guess, the sides of the table. And so I'm improvising and using Scotch tape, but it would actually be paper tape from the hospital. Okay, so I make sure that I'm getting 4 pieces of tape. Okay, like so, and placing them on the edge. Okay. So now that everything is together, have my tape, all of my open sterile materials, I can now put on sterile gloves. So I would open it like so. Use the fingertips to open. Okay. Okay. So you will want to place the glove on the dominant hand first. So my dominant hand is my right hand, so I would place it on there first. Alrighty. I want to make sure that I wash my hands before I put on the gloves. And I would do so like this. Alright. Pick up the other glove to put it on. Okay. I want to fix my fingers in this glove. I believe it is placed on sideways. Alright, so I didn't turn it to where the thumb goes in. So I want to fix that and just make sure that I'm still in my sterile area. Okay, so this is my sterile area, and I dispose of that. Here's my wound. Okay, alrighty, so we have our abdominal pad here. Okay, a gauze. Okay, so we're going to be doing a wet to dry sterile dressing. So when we do wet to dry, it means we're going to be using our normal saline. The normal saline would be opened before and poured onto the gauze. That's something that you do before you put on your sterile gloves. And so we'll pour that onto there. And what we would do is we would take this gauze, I would place it into open it up and place it into my left hand, as so. And then I would take a Q-tip, because that's what we're going to use to pack the inside of the wound. And so with the Q-tip, we don't want to make like stabbing motions, just kind of want to like sideways use it, right? So that's what I would do. Right? And so another thing that I forgot to do was to measure the length and width of the wound with the Q-tip, as well as assessing the area to make sure that everything's okay. Also making sure that we squeeze out the gauze so that it's not too wet. Right? So now that we have that, we would take our 4x4 gauze, so we place one here, and we place the other here, and then on top of that we place our abdominal pad. And so the blue line is always facing up to the sky, so that's here, right? And oftentimes, so we can't cut this because it prevents the purpose, but we can fold it, right? But for this purpose I'm not going to, and we just place that on top. Okay, and once you do that, so we've placed all of our materials there, and so the tape is not sterile, but now that we have everything there and everything's covered, we can now use our tape. Okay, so our first piece of tape is going to go this way. So there's different methods that you can use to tape the wound. My method personally is just taping around all edges. Okay, so you just want to make sure that it's taped to the wound. Okay, and so if this was an actual person, that would be flat on skin. Okay, place at the top. It would also be flat onto the skin, and then one on the right, and that would also be flat on skin. Alrighty, then after that, I would remove my gloves, as so. Dispose of them, wash my hands, make sure that the patient doesn't need anything before I leave, and then I would also dispose of all of my materials, as so. And that would be the end of my session. But before I go, I just want to make sure, another mistake that I made was that I didn't check the saline. So when you check the saline, you have to make sure that it is within 24 hours. If it's not, you have to throw it out. If it is, you can still use it. Alright, and I believe that is the end of my video. Thank you.